Thank you. Well, I appreciate the invitation and an opportunity to come and speak to you today. I have two objectives. The first objective would be just to introduce this group into a study case study that we just recently completed this summer. That was entitled "Case Study: Is It Time for an NPIP-like Program for the U.S. Pork Industry?" And just due to limitations of time and so on, what I would really encourage you to do, and each of you as leaders in the U.S. pork industry, is really point people to this website where it provides interested parties. It's at USSwineHealthImprovementPlan.com, a variety of ways to consume the information. Okay, and in particular, if you're interested enough to review the information, what I really would appreciate your opportunity is to provide some feedback through the online surveys, just a 6-question survey. And my objective number 2 is just to introduce a proposed pilot program that we're just in the process of assembling, a proposal entitled Establishing ASF Monitored Supply Chains in the U.S. Pork Industry. That would be an example of one potential next step related to the findings of this case study. So, to the case study. First of all, what is NPIP? What does NPIP stand for? It stands for the National Poultry Improvement Plan. NPIP is an industry, state, and federal partnership, really, that has long played a central role in bettering the health of U.S. poultry and the competitiveness of the U.S. poultry and egg industries. Our study had 3 objectives. The first objective was to really seek an in-depth understanding of NPIP what it is, why it exists, how it works, how it has evolved over time, and why it seems to work for the U.S. Poultry and egg industries. Number 2 was to clarify how the NPIP program differs from and complements the secure food supply plans for the U.S. poultry and egg industries. And number 3 was to assess the needs and potential applications for a similar program in the U.S. pork industry, i.e. the U.S. Swine Health Improvement Plan. So what is NPIP? NPIP is a cooperative industry, state, and federal program that serves to safeguard, certify, and represent the health of U.S. poultry. It's implemented across the U.S. poultry and egg industries. Participation is voluntary and essentially universal across commercial operations. The NPIP health status classifications are the officially recognized standards of health of U.S. poultry used to demonstrate freedom of both trade and non-trade impacting diseases. What does NPIP do? They approve diagnostic tests. They determine the requirements for specific health status classifications. They certify diagnostic laboratories, and they maintain and verify the status of participants and host such information on their website. How do participants use NPIP? They use them to certify the health status of their flocks, hatcheries, products, meaning chicks and eggs, the status of supply chains to slaughter plants, and industry segments of what they call subparts in accordance to the NPIP standards and definitions. And although NPIP certifications, specific certifications, all participation in NPIP is voluntary. However, certain certifications are commonly required at either points of sale, exhibition, or for interstate or international commerce. Okay, and what we've done here is this is a pictorial that we tried to kind of encapsulate what NPIP is in one slide. Okay, and so we'll spend a little bit of time on this one. It starts really up here in the core of it it starts up here in the upper right hand corner, in that there's a Congress that they call their Biennial meeting, a Congress of industry stakeholders that comes together every 2 years to define and continually update the program content. And there's a tremendous amount of pre-work. There's a general conference committee, there's a technical committee, and proposals that are brought forward to this body of delegates that have representation from all the participating states, and within states by representatives representing the different segments of the given poultry and egg industries, okay, to essentially vote on proposed changes. And it's a very active program and very active process. We had the opportunity to go to the meeting last summer in 2018, which was just outside of Nashville. And as some example, there was 42 proposed updates to the NPIP program just that year, and they said that's about normal. And as an example, 36 of those passed and 6 failed. Okay? And then the program is coordinated, or you might say facilitated, by USDA Veterinary Services. Okay, a small group of 5 employees, 2 veterinarians, 3 clerks that sit in Georgia, and their primary responsibility is to play a facilitation role, but really it's a lot about maintaining the program documents. And their primary goal is to ensure by the time the next biennial conference comes around, they have all the program documents updated from the changes from the previous meeting. Okay? And then it's administered at a state level by what's called official state agencies, and essentially they adopt and administer the program to meet the needs of the industry, the poultry and egg industries in their respective states. And producers and packers implement the program in accordance with the certifications they choose to hold. Okay? And so why does NPIP work for the U.S. poultry and egg industry? One, we think this operational structure, okay, if you go back to this pictorial, that looks like a lot about the continuous improvement model. Okay, we think that's a big thing. That it leverages the breadth of industry participant know-how in defining and more directly informing and addressing poultry health-related items of high relevance over time. Okay, there's a critical mass of participation, again, essentially universal among commercial operations, and provides clear and uniform standards across all 50 states. Okay, and it's both recognized at a national level and then internationally as in its role in supporting trade via the USDA associated certification. It's been around a long time. Actually started back in the 30s, 1930s, to eliminate plorum disease from breeding poultry. Okay, and then since that time, additional pathogens and other types of certifications related to biosecurity and so on, compartmentalization, have been added over the course of time. Okay, but its core, dating back to its origins, have been around certifying breeding poultry as being free of specified vertically transmitted diseases. And here just depicts a number of the various certifications for breeding poultry for the various different types of breeding poultry. And there's currently the one in 2006, the commercial poultry industries were brought into it. Okay, and that's fairly recent. Okay, and that is around this H5, H7 avian influenza monitored certification of commercial poultry operations. Okay, and those what that does is that it provides a system for demonstrating freedom of avian influenza in general, and in particular H5, H7 influenza from supply chains to meat-type turkey and meat-type chicken slaughter plants, as well as table egg flocks. And in that system, the entity that actually sells the product is who holds the certificate. Okay, so it's held by in that world, it's held by the slaughter plants, and they in turn hold their suppliers accountable to be complicit with the standard, as well as the table egg flocks. Provides a system for ongoing surveillance and has played a really critical role in helping sustain markets, export markets, and ongoing interstate commerce in unaffected states and regions during times of events of AI significance in the U.S. One of the primary questions that we got when we first brought this proposal forward to do this study, primarily by people that were maybe more attuned to the U.S. pork industry and not so much exposure to the poultry industry, was, well, how is this different than Secure Pork Plan? These secure food supply plans. And so in the study we go through that in fairly detail and would point you to that. But as we can see here, quite a few differences and so on. And really, again, the secure food supply plans are really just about trying to have a system to be able to move, try to get a plan to be able to, in hopes of being able to move product from within control areas during a time of an FAD outbreak type situation. But I think the core difference is that the NPIP is trade and non-trade impacting diseases, and it's an ongoing living, breathing system that's happening across all 50 states, essentially across all commercial industry participants on a day-in, day-out basis. So another piece that we go into the study is assessing the needs. So does the industry is there needs in the industry for such of a program? So we ask this question, does the U.S. pork industry have any major animal health related challenges that extend beyond the immediate influence of an individual producer, packer, or existing organization? And it's a good question. In that the U.S. Poultry Egg industry is that NPIP is a unique organization and system amongst the livestock commodities, meaning the poultry industry, and within that even the specific segments of the industry, are the only people that really have their own system that play in this space of animal health programs and rules that's species and industry segment specific. And so in the report and so on in the study, we go into major, what are some major animal health related challenges facing the U.S. pork industry. One is obviously issues with trade impacting disease related market risk as it relates to our export centric industry that we have today. And number two is going into these recurring endemic diseases of high consequence, and specifically related to diseases that we can readily eliminate from breeding stock, but are often succumb to subsequent lateral infections, things such as PRRS, PDV, mycoplasma, and so on. And then in the study, we go into what are potential roles or applications for an NPIP-like program for the U.S. pork industry, and really kind of three primary buckets. One would be a systematic way for reducing trade impacting disease-related market risk to the industry. Number two would be a framework to facilitate larger scale health improvements to the health of U.S. swine that extend beyond the immediate influence of an individual producer, packer, or state. And number three, the value coming from establishing an officially recognized and democratic forum of industry, state, and federal partners that are empowered to directly address issues of swine health that have broad impact across the U.S. pork industry. And in it, we go through pros and cons, really pros being very similar to the applications, reducing opportunities for reducing trade impacting disease-related market risk, mitigate recurring endemic diseases of high consequence, and in this forum to more directly address these issues. And cons, meaning time and money. Much of the efforts to put forth such an effort are really things that aren't happening today. Uncomfortable discussions amongst peers, again, because this is a democratic, the way that the NPIP is structured, it's a democratic forum amongst your peers to come to agreement upon standards, definitions, and rules, and the consequences of having standards or rules. And we go into that all in quite detail. Then we go into, what are options for the operational structure of such an initiative, what would be the hurdles to move forward, and potential areas of emphasis, or what you might say would be initial deliverables. And so in that, we go through and we talk about, what would be potential components of a U.S. swine health improvement plan. Okay, one potential area of focus or emphasis could be on systems for demonstrating evidence of freedom of trade impacting diseases outside of control areas. Number two might be establishing officially recognized health status classifications for endemic diseases of high consequence. Number three might be the establishment of officially recognized standards for traceability, certifications to go along with that, which would be irrespective of pathogen. Similarly, for sanitary standards as it relates to associated with a certification, again, irrespective of pathogen, for things such as on-farm feed supply chains, live haul, and the necessary to support a given certification. And when you get into any sort of programs type of thing, terminology becomes very important. Terminology about definitions of your terms that you're using to define program standards. And I think in the end, it kind of came as we were going through this, we kind of came to this question, is that as you're assessing potential needs and so on, and you ask the question of, will the current systems of health where the current systems and approach of animal health control in the U.S. deliver the larger scale swine health assurance solutions that are necessary to support the 21st century U.S. pork industry, which could be adequately described as export-centric, highly mobile, and composed of multi-site and multi-state production systems. And I think, as this group well knows, is that our industry, the impact of the growth and now subsequent dependence on export markets, the advent and expansion of multi-site production, and the growth and expansion of multi-state production systems. And so what this graph represents is the number of pigs that are being moved across state lines on an annual basis, okay, to be grown or bred, and globalization. Each of these three factors have had a significant impact on the changing face of the U.S. pork industry. And it seems as if that there's a clear need to be able to diversify our approach for managing what one might call animal health related market risk by having clearly defined systems for demonstrating evidence of freedom of diseases across areas, regions, industry segments, and supply chains. And that it doesn't appear that there's any shortage of long-term needs for the continual improvement for improving the health of hogs, whether that be around sustaining access to export markets, meeting the consumer expectations and demands, and probably nothing smaller than the bottom bullet point there of a decreased public level of understanding and empathy for some of the challenges facing U.S. animal agriculture, or modern animal agriculture. So I think in the end, kind of our take-home message from doing the study was that the NPIP program and approach is just a model that surely seems that it's a well-proven model. It's been around a long time for the largest protein production or livestock industry in the U.S., and that it's just a model that could be looked at as a potential model for the U.S. pork industry to consider. And that this thing is for us as we were going through this, is to me it's kind of like an opportunity as it relates to preparing for the future. It's not a quick fix. It's we say here, it's a lot about maybe for the next 25 to 50 years, and not about what's going to happen next year. But asset and industry preservation certainly come to mind, and the opportunity for a way of life for industry participants in the communities at which we all live and work today. And I think that it's clear to recognize that there's no short-term fixes to the major challenges facing the industry today, and that next generation solutions appear to be needed. And so if you're interested, again, would point you to the website, and again, as each of you as leaders, I would really encourage you to take a look at it, understand it's quite a bit of information, but hopefully we have it down to different ways to consume it, and maybe we'd really appreciate your feedback through the online survey. Would be just fabulous, okay? And kind of where we are in the process, I would say, kind of put this learn, share, feedback, action, impact, is we spent the last year learning and tried to create our learnings into to hopefully a digestible document that has value for pork industry stakeholder reference. We spent this summer creating it into a platform for more broad scale sharing, put that together, and now the meetings like this and this fall start to push it out. We'll be looking for stakeholder feedback and move to say, is there interest, and so on. And as we've kind of thought through this, I think there's kind of three potential options for action. Is there'll either be no interest, which is status quo. There'll be either, or there could be interest and potential resolutions put forward through our different industry associations and organizations type of thing for the establishment or study of some such effort. And or there could be pilot projects. And if there is interest, number two, resolutions and pilot projects could be moved forward in tandem. And probably the primary questions are around scope and structure, meaning where is there interest, if there is some, and how might the effort be structured. Okay? So that was objective number 1 about the study. And objective number 2 is to discuss this proposal that we're in the process of putting together around this proposed ASF monitored program. Okay? And the objective would be to develop and implement an active ASF monitored pilot program modeled after much of the basic tenets of the NPIP's H5, H7 avian influenza monitored certification of commercial poultry operations. The purpose would be to enhance all 3 phases of ASF preparedness from prevention of entry into the country, to enhance our response capabilities as well as our recovery capabilities and continuity of business associated with recovery. And number 2 would be to get some exposure and experience within the US pork industry for implementing an NPIP-like program. Gotcha. Okay, there we are. The idea would be is that the participation would be by voluntary participants, people who are interested. The participants would be producers, packing facilities, and states. The certificate holders would be producers and packing plants. The requirements for certification would be that you would be enrolled and meeting the given requirements. You'd have to have a valid VCPR with an accredited veterinarian and meeting the core standards around sanitary standards related to feed supply chain, on-farm and live haul, traceability standards related to your demographic information and so on for your site and PIN, and swine movements being available for electronic upload as needed, and come along with some defined surveillance testing requirements that are utilize state-of-the-art sampling regimens and diagnostic tools that are based on the farm type and the ASF status of the country. Okay? With the governance of the pilot program essentially being facilitated by the investigators to facilitate the program, maintain the current documents and some summary level reporting, the establishment of a technical advisory committee that would put forth suggested guidelines and standards around sanitary standards, surveillance and diagnostics, and traceability that would be brought forth to a House of Delegates, which would be the decision-making body on the program standards, with representation from the participating states in proportion to the size of their pork industry, essentially modeled similar to the pork forum approach to decision-making. And that there would be a certifying agency at the state level whose primary role that would be an entity assigned at a state level to administer the program, maintain the list of participants and their associated information, and be responsible for verifying participant status as needed. And participants' responsibility would be to enroll, to meet or exceed the requirements for certification, and verify compliance on an as-needed basis. The costs associated would be some administrative costs for administering the program, some surveillance testing that would be a component of the requirements, and the participant costs for maintaining compliance with funding would be questioned at this point, but likely from multiple sources. Okay, and so that was just this discussion around proposed pilot program for establishing ASF monitored supply chains. Again, would be ongoing, aimed to enhance all 3 phases of ASF preparedness, provide guidance for a demonstration of freedom of ASF outside of control areas for freedom of supply chains, areas, and regions. Okay? I think with that, I'll take any questions.
Thanks, Roger. We got plenty of time for questions if anybody has any.
What's the status of the ASF pilot project?
It's cutting edge. Joe asked the question is, what's the status of the ASF pilot program? It's cutting edge. So it's in the proposal's in development, and it came from, we just started pushing information, pushing information out about our study and efforts to get feedback. Okay, and some of the initial feedback is, it's kind of like, well, and then, well, that sounds interesting, sounds like a reasonable idea, maybe it sounds like something the industry needs, but it doesn't exist. How would you get it started? And then what's the quick fix for ASF? Okay, and the probably answer to that is none. But there's clearly an interest, I think, Joe, and need in my assessment for an industry-driven effort to be focused on establishing a system around being able to enhance preparedness and being able to demonstrate freedom outside of control areas, okay, and establish this system and get some exposure to a system of, do you have clearly defined testing requirements that make sense for different types of farms outside of control areas? Yes or no? Do you have well-defined sanitary standards that are practical and can be done and would be effective? Traceability and so on. And so our hope is that here over the next month or so, we get this proposal ferreted out and we start to shop it around, okay, to see who might be interested. Who might be interested from a state level standpoint, and when I say that, it's going to be largely dependent on the state veterinarians' acknowledgement that I would recognize such a program and interest in participating. It would be packing entities and producers, essentially supply chains, and say, could you get a supply chain or two, a state or two interested to move something like this forward?
So when you discuss funding for the US Swine Improvement Plan with grants and such, what funding is, who funds the NPIPs?
It's a great question. The NPIP is it's multiple sources of funding. So federally, it's $500,000 funds like the administration of the National NPIP program. That's basically your 5 people in Georgia. Okay? At a state level, it's all over the board. Okay? Meaning how it's funded. Okay? And generally comes from the participants themselves, so they pay participant fees, okay, for participation. And then varied levels of state, some stuff from state departments of agriculture, things like that. And then they get some USDA cooperative agreement funding that generally ranges from $50,000 to $150,000 a year that comes from the USDA to the state to help provide some support. So it's participants carry the largest load, and then supplemented by, depending on state, some state funds and then a bit of USDA funds.
So the participants or producers, is it prorated on the side of the flock?
Right. Yes, they pay for the certification, and and a lot of them have been by breeder fees, and again that varies by state, because each state that participates in that model is they have to have an official state agency, okay, and so it's like how they support the program in their state is incumbent upon them, and it varies substantially by state how much of it is basically by participant fees, by some line item from the Department of Ag, and being supplemented by some smaller level from the USDA. But participants unquestionably carry the load.
Got time for another question or two, if anybody has them?
Are you directly involved with the NPIP?
Yeah. So it's sort of interesting. The question was, are we involved in NPIP? And of course, since I've been to the lab now for about 10 years, and we've always been an NPIP lab, right? But I told everybody going through this, it's like I knew I didn't know much about NPIP going into the study, but after going through the study, and particularly after participating in their NPIP Biennial Conference, and then by spending time visiting various states with well-respected state-level programs and poultry producers, it's like I figured out I didn't know anything about NPIP. And the other thing I would tell you is that at the their biennial meeting, right? It's a big meeting, right? All states represented, all these voting delegates and so on. And it's like I knew 2 people, right? So there isn't a tremendous amount of crossover between pork people and some of the pork industry.
I'll ask one more question. So I became an instant expert on NPIP when I came to Biennial, Minnesota, because we're also an NPIP now. So okay, far from being an instant expert. But one of the components of the program that's fairly new, following the high-path avian influenza stuff, is that, for example, for indemnity for birds or compensation for cleaning and disinfecting, the program requires that producers participate in biosecurity plans that are filed and audited by the states. And so that's, we're talking about a program that's been in existence since the mid-30s, and we're not, I guess, expecting to ramp up to that speed.
Right.
But has there been any discussion in terms of questions of indemnity from the USDA for swine programs, or is that just too early to be thinking that way?
It's a good question. No idea. But if you go through the study, it shows the progression of NPIP, and I think one of the core things is it goes back to this. It's like a model that can continue to exist, get smarter, and so on, and adjust over periods of time. And the other part, I didn't have this, but I think this is a big piece, is, I don't know if that picture's any better than that one. That one's a little better. Is so this was at their biennial meeting, but the picture, I think, illustrates, like in a nutshell, what NPIP is. Okay, meaning it's a democratic process of determining what are definitions, standards, and rules for specified certifications within your given industry. Okay, and what this picture shows, what these people are doing, these are the delegates, right? So they're voting. Okay, and the reason they have different cards, see these different colored cards, they're voting for so they're sitting kind of by state, by table, okay? But then the cards are representing different industry segments, okay? Because you can only vote on the segment of the industry that you represent. Because not all, proposals or areas of NPIP affect all segments, right? So it's kind of like you only vote for the stuff that it impacts you, if that makes sense. And the other piece, and this is why from a political standpoint where I think it makes a difference, and there's probably only a few folks in this room that know who these people are, is so this was Jack Shear, the lead chief veterinarian for VS that just changed hands recently. And then this guy here is a guy named Alan Huddleston, who he's over the poultry, pork, and aquatic programs for the USDA. And then this guy here, Fidel, he plays a lead role in helping some of their indemnity programs for the USDA and poultry programs and so on. But the gist of it is, these people are here, they're listening, they're not voting, but they're in the room around all of this due process that's been going on, leading up to the meeting. It's 2 days out of the meeting, and now we're making decisions about what our standards and definitions are going to be. Okay? So, I'd share that.
Let's thank Rodger for his presentation.
Thanks.